Aloha and welcome. My name is Jackie Boland. I'm the Community Outreach Director for AARP Hawaii, and it's my pleasure to welcome you today to the 2021 Hawaii Veterans Summit. And today we'll be talking about maximizing performance and managing pain. I want to just acknowledge our sponsors today, the Hawaii Veterans Foundation, the Hawaii Office of Veterans Services, and AARP Hawaii. We've all worked together to put together a series of webinars over the last 4 or 5 weeks, and we have 3 more following this one. I just want to give you a peek at that schedule. On July 16th, estate planning, that's this Friday. July 20th, behavioral health panel discussion. And July 27th, we'll hear from former POW Jessica Lynch. If you want to sign up for any of these, there's multiple avenues, but the one that is very reliable for you is www.hawaiiveteransfoundation.org. If you're new to Zoom webinar, I just want to do a quick mention of our controls. First of all, you're not going to be needing the raise hand function, and we'll ask you to submit questions for the speaker in the Q&A tab at the bottom of your screen. If you want to ask a technical question, myself or volunteer Vicky Franco will be on the chat to answer your technical questions. Also, we have closed captioning on because we did get a request for closed captioning, but if you don't like it, you can click on that live transcript button that says CC at the bottom of your screen and choose to close or hide the subtitles. So the other thing is up in the upper right of your screen, if you're on a computer, you'll see something that says view. We recommend that you choose speaker side-by-side view for the best possible results. And now I'd like to introduce Dr. David Brown, who will be our moderator today. Dr. Brown has been a very active member of the Summit Committee and is one of the organizers, and he has put together today's session. He'll be serving as the moderator, so any questions you put in the Q&A, he'll be asking for you. Dr. Brown?
Hey, thank you very much, Ms. Boland. Before getting started, I'd just like to thank Ms. Boland and Ms. Franco for all the assistance, not only today, but in the weeks leading up to today's event. So thank you so much. And I think there's a little slide there giving a little background on me and some of the things I've done of late. It is my distinct privilege and honor to introduce you all to Major Cox Coleman, Kara Cox Coleman. Now, Dr. Coleman, are you a colonel yet? I mean, with all the stuff you're doing.
Maybe soon, one day.
I want to give you all a minute here. I don't want to insult your intelligence and read her background there. Oh, it was up there. There's a beautiful background on her. I was just going to supplement that slightly to say, well, you all have it when you logged in. You see her background. The thing you don't know is we had a distinct privilege of working with one another on a few occasions, going off on global health engagements to Nepal. And it was a distinct privilege to work with Major Cox Coleman in Nepal, and some of the work we did with the Air Force, the U.S. Air Force, U.S. Navy, and a number of other people in other countries. So I'm very excited to hear her speak today. She spoke 2 years ago, I think it was the last time we worked together, and that was at the Hawaii Veterans Summit at the Convention Center in 2019. So without further ado, let me get out your way and let you do your thing, okay?
All right, sounds good. Thank you for the introduction. And thank you so much for having me. So just one quick thing, I will ask you all, there's the price of the admission to this talk right now is that you pay this forward. There are 50 million people in the United States with chronic pain, and not all of them have access to these resources. So whatever you learn today that you find helpful, I'll just ask that you pass that on to somebody else. All right, so we're gonna start the session today with a video. Hopefully we'll see how it goes. That really lays the foundation for why I'm going to discuss with you the things that we're going to discuss. So let's see if it will cooperate.
everyone agrees that pain is a universal human experience. We now know that a person's pain experience is 100% of the time produced by the brain. This includes all pain, no matter how it feels, sharp, dull, strong, or mild, and no matter how long you've had it. You might have had it for a few weeks or months. This is called acute pain, and it's common with tissue damage, say from a back injury or ankle sprain. And this is a normal and sometimes a protective response from your body. And generally, you'll be encouraged to stay active and gradually get back to doing all your normal activities, including work. Or your pain might have lasted for 3 months or longer. And this type of pain is generally called chronic. And with this type of pain, tissue damage is usually not the main issue. What's often less clear, though, is what you should be doing when you're told you have chronic pain. Well, in the United States, chronic pain is a really big problem. 100 million adults, that's 1 out of every 4 people, have chronic pain issues, and this can be extremely frustrating. Having a brain that keeps on producing pain, even after the injured body tissues have healed, is no fun. Those with
There must be something wrong. This presents a real challenge for them and the healthcare providers who are trying to help. For most people, once anything dangerous is ruled out, healthcare professionals can explain that most injuries in the body are healed, as well as they can be, by 3 to 6 months. So ongoing pain being produced by the brain is less about structural changes in the body and more about the increased sensitivity of the nervous system. In other words, it's more complex. Well, to try and figure out what's going on, you need to see how you might retrain the brain and nervous system. To do this, it's helpful to look at many of the things that affect the nervous system and may be contributing to your individual pain experience. What can help is to look at chronic pain from a broad perspective. And by using a structured approach and a plan, it's less likely that anything important will be missed. Let's begin with the medical side. Your healthcare providers will likely ask you to rate your pain level on a 0 to 10 scale. While it's natural to focus on getting your pain as close to 0 as possible, it's equally important to pay attention to how your pain and the treatments used to manage your pain affect your function and things like mood, stress, sleep, and activity. Initially, taking medications, as directed by your healthcare provider, can help, and then usually they can be tapered and eventually stopped. However, it is usually the more active approaches that are necessary to retrain the brain, so your healthcare provider might recommend you also try other complementary treatments for your pain, things that might help keep you moving, such as physical therapy, acupuncture, yoga, or massage. Some people feel that surgery might be the solution for their pain, but when it comes to a complex problem like chronic pain, surgery is usually not the first answer. It's best to talk to your primary care provider to consider everything that could be contributing to your pain and what treatments are best for you. Next, it's also helpful to consider how your thoughts and emotions affect your nervous system. Pain really impacts on people's lives, and this can have a big effect on your mood and stress levels. All those thoughts and beliefs are brain impulses too, but you can learn ways to reduce stress and wind down the nervous system. This helps with your emotional well-being and can reduce pain as well. The third area to consider is the role of diet and lifestyle. Now, it turns out that our modern lifestyle might not be so good for us. In fact, what we eat and how we live may really be contributing to a sensitized nervous system. Looking at all the things, like smoking, nutrition, alcohol, and activity levels, and seeing if there are any issues is a good beginning, and these things can go on your plan. Then, there's often enormous value in exploring the deeper meaning of your pain and the surrounding personal story. By stepping back and looking at all the things that were happening around the time the pain developed or increased, many people with pain can make useful links between a stressful period of life and a worsening pain picture. For many, recognizing deeper emotions can be part of the healing process. Last, but by no means least, is physical activity and function. From the brain's perspective, getting moving at comfortable levels without fear and where the brain does not protect by pain is best. And you'll gradually restore your body's tissues. So, to sum up pain, it comes from the brain, it can be retrained, and when looked at from a whole person perspective, you can often find new ways to heal and manage your pain. So, make sure you're doing your part. Get a helping hand if you need it. Set your goals and continue living your life.
Okay, so I think you all may have missed a couple of minutes of the video, but that's okay because we're going to go over it again in just a few slides. So this is performance enhancement through education and action. While many of us may not consider ourselves athletes, the approach that we take to chronic pain treatment is one of enhancing your performance or getting back to a quality of life that you really are looking forward to being able to accomplish the goals that you set. And that's the purpose of our time together today. So here's our agenda. Again, we really focus on education as part of the treatment for chronic pain. So we're gonna lay the foundation about what acute pain is, what chronic pain is, and then we'll get into the discussion about how we used to treat chronic pain and how we do that now. And of course, as folks that have chronic pain, or if you know people that have chronic pain, you all are integral parts of chronic pain treatment. So let's begin with a discussion about pain, because when we have chronic pain, sometimes we can forget that pain has a purpose. It just feels annoying and we want it to go away. But pain actually serves as a warning function. It can be a symptom of underlying disease or injury. And it involves complex interactions between different parts of our body, our spinal cord, and our brain. If you've experienced pain or if you've experienced chronic pain, you can attest to the fact that pain is both physical and emotional. It involves learning and it involves memory. Acute pain usually results from disease, inflammation, or injury, and it generally comes on suddenly. Sometimes we can identify the trauma that occurred, and sometimes we can't. The cause can usually be diagnosed and treated, and the pain ends after the injury heals or the disease runs its course. So in a practical way, the way that this looks is, let's say you get out of bed, your favorite dog has left their most prickly toy on the floor when you all went to bed, and you get up in the middle of the night, it's dark, you're trying to get to the restroom, and you step on the prickly toy. And immediately you feel this pain, and you also might have some thoughts about that dog. I can't believe you left that there. And you might not, you feel some kind of way about it. So what's happening in the body when you experience that acute pain is that a pain receptor or a receptor on the bottom of your foot signals that you have stepped on something, and it sends an electrical impulse up your leg, all the way up your leg into your spinal cord, and then that signal goes into your brain. And the first part of the brain that hits is what we call the primitive brain. It's that part of your brain that's trying to keep you alive. We call it the fight or flight response, and it says, get your foot off of the toy, right? Or if you touch something hot, it says, pull your hand away, and you don't even have to think about it. It's just the reflex. That's the part of the brain that navigates that. Then that signal goes up further into your brain, and it activates areas that are responsible for learning and for memory as well. So the whole point of pain is to keep us alive, right? So, and we don't want to have to learn to not put our hand on the hot stove more than once. So that's why all of these areas of our brain light up and participate in the pain signal, so that we, one, can remove our hand or remove our foot as quickly as possible, and two, we remember how painful it was to stick my hand on the stove, right? And I felt some kind of way about it. I felt sad about it, angry about it. And so I'm far less likely to do that again. And that's good. We want pain for that purpose. Now, sometimes acute pain lasts longer than a few months, and it turns into persistent or chronic pain. Chronic pain no longer serves as a useful warning function. I don't know if any of you have any of those newfangled doorbells, the Ring, and sometimes they're set really on sensitive, right? So you'll get these notifications on your phone and you look at it immediately and you're thinking, oh, somebody's trying to break into my house. And then you check and it's just a car passing on the street, right? Or it's a squirrel that ran across its line of sight, right? And so, but every time you're aroused and you think, oh my goodness, what's going on at the house, right? So it's not so helpful. It's set too sensitively. Basically, this is what happens with our body and chronic pain. Chronic pain is our body and the pain process, the pain signal has become too sensitive, and it's alerting us of things that aren't really dangerous. Okay, so maybe just basic movements will make you feel pain, right? So it's a broken system, if you will. It's a system that has developed a bad habit and we need to retrain it. So this is where we're really going to today, is understanding that chronic pain is a whole other diagnosis, right? You might have had this acute pain that resolved it, or it didn't, and it kind of stuck around. But now chronic pain, it's not telling you anything useful, right? So it's a whole new process, a whole new disease process that we have to treat differently than we treat acute pain. So just for your awareness, again, we treat it differently because chronic pain is resistant to most medical treatments. If you sprain your ankle, you break a bone, you're going to go into the doctor and the doctor is going to treat you medically. They may give you meds, may give you surgery, they may have you rest, although, you know, we're kind of moving away from that too. But those types of treatments, chronic pain does not respond well to. So we have a whole other way of treating chronic pain. So pain can be a stressor, you know. So remember I said the pain signal, it activates the fight or flight portion of your brain. That portion of your brain is also activated by other stress. So stress like having chronic pain can activate that system, right? Stress like, oh, you've got a lot of stuff going on at home, or you have financial problems, or perhaps somebody else in your family is sick. So all of those things can activate that same portion of your brain. And what happens is you may begin to experience things in your body like muscle tension, you know, increased heart rate, problems sleeping, all of these in response to stressors, to include chronic pain. So we want to make sure that in terms of the way we treat things, that you aren't adding more stress to the system, right? That you understand how this whole process works. And the whole goal is to understand that stress can be helpful. It can be a motivator, absolutely. But we don't want to have so much stress in our lives, to include chronic pain, that we are ineffective at doing life the way that we want to. And so the skills that we're going to learn today really are geared at helping you to kind of down regulate, or as otherwise known, is to kind of get your body into that rest, relax, and digest system, which is my favorite system. I like to rest, relax, and digest as much as I can. All right. So, but it takes an awareness and an understanding to how do I apply these skills in a way that's going to help me to be motivated in life, but not be so stressed out that I am ineffective at living the way that I want to live. Okay. So again, I've mentioned some of the physical responses. Many people with chronic pain will complain about some of these other symptoms. it's kind of this loop that goes, that we'll talk about a little bit more. So not only can you experience some physical symptoms of stress and some physical symptoms that are precipitated by experiencing chronic pain, but psychological responses occur as well, right? So some people can experience an increase in worry. Some people can experience a decrease in attention, right? Sometimes we're paying attention so much to this pain that we are unable to pay attention or give the attention that we want to be able to give to other areas of our lives. People with chronic pain often feel increased irritability, anger at the situation, right? Is this ever going to get better? Anxiety, sadness, and just generally speaking, feelings of helplessness and hopelessness, particularly if you've been dealing with chronic pain for a while. And then kind of as those things build and we don't know what to do with them, it can lead to some explosiveness, right? So just out of control temper. Again, folks that have chronic pain, we have seen folks that are struggling with substance abuse and misuse as an attempt to try and treat or numb the chronic pain. And sometimes people just don't want to deal with other people, right? I don't feel good, my body hurts, I'm mentally exhausted, and I just don't feel like fooling with folks. And then performance declines. In our active duty population, often this is what brings people into the clinic eventually is, I'm not able to do my job the way that I want to or the way that I used to be able to. So again, for all of those reasons, it's really important that we take a very holistic approach to the treatment of chronic pain. So in summary, pain does serve a purpose. It is our body's warning system that attempts to keep us alive. Persistent and chronic pain leads to continuous activation of that fight or flight system and some other areas in our brain. And it actually leads to brain changes, right? So learning is all about developing new pathways in our brain. And sometimes we develop pathways of learning that we don't want. And that's what happens in relation to chronic pain. So how do we undo that? We have to retrain the brain. Okay, so all of the things that we're going to talk about today, I want you to envision them as if you were an athlete and we're putting you on a training program. So that you can retrain the brain and again, be a top A performer like you want to be. I'll pause for any questions, comments, or concerns. Looks like there's some.
We do have one question. David, are you going to field that? Sounds like he's having a little trouble getting on. We have someone who says, I had dry needling and had the best pain relief. Can I get that therapy at Tripler?
Yeah, so there's some, I would check with your primary care manager to see if they can help you out with that. They do offer that service here at Tripler. It depends on the clinic and the provider though. So I would just check with your primary care manager and see if that's something that they can put a referral in for.
Terrific, thanks. That looks like it. Just a reminder to folks that you can put questions in the Q&A for Dr. Cox-Coleman. Also, just a heads up that you'll be contacted in the chat by Vicki if you've won a door prize.
Oh, nice. All right. So the way that we used to treat pain, so again, this has been like a 20-25 year evolution of the treatment of chronic pain. It was very singularly focused. And now we treat chronic pain from a very holistic perspective, which we call the biopsychosocial approach to pain. So the old way is what we call the biomedical way. And that's the way that we treat many other medical conditions. Again, although there is a shift in medicine, generally speaking, to understanding that when we're treating people, we are actually treating the whole person and not just the symptom. So the new way includes, again, a holistic perspective, because chronic pain involves every part of us, right? It is physical, it is emotional, it is cognitive, right? It affects how we feel in our body. It affects the feelings that we have, the emotions that we have, and it affects how we think about things, right? And in order to really holistically treat chronic pain, we must look at the factors like, the way we think about things and the way we feel about things and how they can maintain our experience with chronic pain or even make it worse. So, for example, we already talked about how there are actually brain changes that occur due to chronic pain, or the brain changes lead to chronic pain is probably the better way of saying that. And that there can be this continuous activation of that fight or flight system that really ramps us up, right? Ramps us up so that we can do something. But in ramping us up and being constantly ramped up, we end up with these really tense muscles and our heart rate's all whacked out and our blood pressure's jacked up, right? And you can imagine kind of walking around daily with muscle tension all squeezed up like this. And how does that impact your ability to manage your pain, right? So for many people, that actually makes their pain worse, right? And not being able to find relief can lead to some mental distress, right? Or can stress us out even more mentally. Doggone it, I really just wish this pain would go away. I've tried everything. My life is just in the dumps, right? And we can get going with these thoughts, right? And the thoughts actually, by the time we're done, playing out all of the thoughts, we're back here. And this repeatedly can lead to feelings of sadness, can lead to feelings of depression. Those feelings can lead us to ruminate or to think a lot about our chronic pain or our situation. And guess what? We go to try and get some relief from sleep, but I'm just laying there in bed like this, all tense, and I can't relax, and my mind won't shut off. And so now I'm not getting good sleep. Well, you wake up in the morning, do you feel better? No, you still feel bad. You may feel worse. And then we start the new day like this, right? With all these thoughts, with all of these feelings and all of these things going on. And so it's important that we understand that we need to treat the whole person. To not do that is like having a car with 4 flat tires, filling up 1 or 2 of them and thinking that's going to be great to get us to go where we want to go. We might get there. It's going to be slow. It's going to be painful, and we might cause more damage to our vehicle than we want to. So that is the approach that we need to take in terms of treatment. So what are some ways that we treat chronic pain? And I want to, again, reinforce that this is a balanced approach. All of these things, most of these things, will be in your toolkit for treating, either maintaining your pain at an acceptable level to you or treating when you have acute pain flare-ups, okay? So movement is paramount. This is a hard one for folks with chronic pain because you don't feel like moving, you hurt. So we'll talk about that more a little bit. Diet, again, really important. Self-regulation, I'll explain to you what that is, but basically it is being able to turn off, as if you were to have a switch in the back of your head, that part of your brain that is being activated, right? Sleep and medications. We're going to talk about all 5 of these things. I'm going to skim over them. This class I usually do as a 4-hour block of instruction. So I will not go as in depth, but please write down any questions that you may have, and I can go in depth with specific areas. All right, so medication. I think what people think of when they think of chronic pain and medication are opioids. And yes, 20 years ago, and even more recently than that, that was kind of the standard of care. We were still learning about chronic pain versus acute pain. And learning about the effects that opioids have. And opioids can be a very effective treatment for acute pain. The problem with opioids is that they are highly addictive. They have the potential for somebody to develop tolerance over time, which means you got to take more to have the same effects. And it doesn't work as well for chronic pain as it does for acute pain. So what we were beginning to discover was the benefits did not outweigh the cost of opioids. And you all are very familiar with the opioid epidemic that we had in our country in 2016 was really kind of the breaking point. You know, we're having lots of people who are either developing addictions to heroin and other drugs who started with opioids, or we were just having folks who were overdosing accidentally on opioids. So we had to back up and really reassess the whole situation. So again, the side effects for the opioids, you know, especially for the long term, were creating more issues than benefit. I mentioned the physical dependence and the tolerance, sleep disruption and impairment. You know, I think we can do that bad by ourselves with sleep, so we don't need anything helping. And actually, for some, it was creating more pain. It made the body even more sensitive to those pain signals. And so we had to reconceptualize how we were treating chronic pain. So opioids are no longer the first line treatment for chronic pain. Non-opioid medications, that is something that perhaps physicians will speak to our patients about, especially if it's going to be longer term use because they have less side effects or less significant side effects. And they tend to do a little bit better in terms of helping folks to manage the pain. So non-opioid, non-pharmacological treatments, so non-medication treatments, and we're going to talk about several of those in a minute, really a focus on the whole person. We're looking at improving people's quality of life, right? So how does pain impact your ability or your enjoyment of life? And we want to address that, right? How does chronic pain impact your functioning? And we want to be able to address that. How can we help you to be more functional, even if you have chronic pain? And then we also look at multimodal treatments, so complementary treatments like acupuncture and chiropractor and massage. Some of these things are now beginning to be paid for by TRICARE. And you'll find many programs, chronic pain programs, that are integrating these and these types of providers into their treatment because it's just that important. The other approach that we look at is behavioral health treatment. Such a huge component of chronic pain is not that you're crazy, because you're not, right? But pain is produced in the brain, and the effects of chronic pain impact your thinking and your feeling, and that's our lane, right? And so much of what we do for the treatment of chronic pain is addressing the way that people think, addressing how people feel and behaviors around chronic pain, so that we can help you all to accept that this pain might be here, but I do have some control and being able to address this in ways that perhaps I haven't been able to in the past. And then the last thing is movement therapies, Tai Chi, yoga, aquatics, these types of things. And again, our program here incorporates all of these, but also many of the other programs on the island and elsewhere have moved to incorporating all of these treatments. questions, comments, concerns before I move on to the next piece?
Dr. Coleman, there's no questions in the Q&A, but this is Jackie. I do have a question for you.
Sure.
I have read and seen that people's memory of pain stays with them, so that even when the body isn't actually physically reacting, the brain makes them think they're still having that pain response. And I was just wondering what the most successful way you've seen for overcoming that would be, or if it takes this whole combination.
Yeah, that's a great question. And certainly that is some people's experience. Our brains are super cool and complex and sometimes a pain, right? But the cool thing about our brain is that it links certain things to memory. So if you think about your grandma's house, right? Often people, if they close their eyes, they can smell her baking cookies, right? Or it has a distinct smell to it. And that is because our brain links memory with our senses, to include pain, right? You remember I said, we want that because it helps keep us alive. We don't want to test this theory of living too frequently. But because that combination, that connection can be so strong and sometimes unhelpful, you're remembering things that are not, and your memory is triggering a pain response that isn't helpful, that's your body's not in danger. We take this holistic approach to address that. It does take time because again, what's happened is your brain has created some new connections, right? Just like learning how to walk or play the piano or play the drums, when you do those things, you're creating pathways in your brain that help you to do that quickly. And your brain does that when it comes to chronic pain. So we have to retrain the brain and untrain those memories, pair them, make new memories, if you will. So that's what we're doing. And we're encouraging people to make this a lifestyle change, because certainly retraining and building new pathways in your brain does not come easily, right? You're not going to be a world-class gymnast or whatever if you just practice once a week. It's not how that works. I wish it did, but it's not, right? So this has to be a lifestyle change where you're doing these things daily, and challenging your body daily, creating new memories, creating new pathways, so that it learns, oh, wait a minute, not the pain brain. That's no, okay. And it shuts down some of what's going on in the brain and builds new components. So that's a great question.
And then secondly, would you say that depression can cause pain for people who have had chronic pain in the past?
So certainly depression can trigger pain episodes, right? It is this weird kind of funky feedback loop. You experience chronic pain, or maybe you're having an acute pain episode, and then you begin to experience some sadness and depressive symptoms, but the opposite works too. The centers that operate our emotions and our memory and our pain are very closely linked. And in fact, some of the hormones and other things that are present during a depressive episode are also very similar, or the same ones that are present during chronic pain. So yes, they all work together. They're all intertwined, which is why just addressing one of these things, we learned that's not sufficient. That's not going to get it. We've got to address all of these components.
Thank you.
Yeah, absolutely. So how do we do that, right? We might be ramped up. We might feel anxious. We might be experiencing some depressive symptoms, or, muscle tension. How do we calm that down? We call this self-regulation. And again, it really is just, if you think of a dimmer switch on the back of your neck, you turning down that that fight or flight response, right? And not only are you turning down that response, but you want to turn up that other system, that rest, relax, and digest system. So in terms of self-regulation, the skills that we train for that are breathing exercises. So diaphragmatic breathing. There's a whole lot of resources on the last couple of slides that we have apps that will train you how to breathe. I encourage you to pick up one or two of those, see what's helpful to you, which one works best for you. But again, breathing, being able to slow down your breath rate, slows down your heart rate. And it is one of the best ways to turn down that fight or flight response and turn up that parasympathetic response. So trying out some deep breathing, laying on the floor if you can, and putting your legs up on the couch or a chair. So you're kind of in a, 90 position, and just closing your eyes and breathing into your belly is one of the fundamental exercises that we start with folks. If your breathing's jacked up, everything else is going to be jacked up. So if you don't do anything else on this list, get your breathing right. Muscle relaxation, again, some of the apps that are on the resource list also will walk you through progressive muscle relaxation exercises. So I would encourage you, once you kind of get the breathing down, to explore some muscle relaxation techniques. And just remember, these are kind of stepwise, and we'll talk about this a little bit more shortly. I don't want you to try all of these things at one time. Your head will explode. Okay, so we're going to talk about making a plan to try each one of these things out, or a couple of them out, for a week or two to see how you like it, see how it works, and then build new skills on top of it. Mindfulness, yoga, acupuncture, we've talked about those things. Also very helpful in terms of the self-regulation piece. And then one of the things that we just stop doing when we're stressed out or have chronic pain, or both, is fun stuff, right? You got to get out and do fun things. Don't overdo it, but purpose to do at least a couple of times a week for 5 or 10 minutes, something that you really enjoy. It could be totally vegging out to Netflix. It could be reading a book, whatever, playing with the dog. But we want you to engage in activities that you find fun, right? Because in your brain, you have some natural pain relievers, but you have to activate them. And one of the ways to activate them is to have fun. So terrible homework, I know, but All right, so here's an example of a couple of the breathing apps. And again, all of these are listed on the resource page in the back. All right, so pain brain equals a stressed out brain, which means that it's just overly activated. Self-regulation helps to calm the stressed out brain, and it can help decrease pain, but it also can just manage it at a level that's acceptable to you. All right, so here are the skills to train that we talked about, and you'll get these tools again in a couple of slides. Sleep. Now, this is one of my favorite topics. I love to sleep, but sometimes it eludes me, and I'm sure that sometimes it eludes you all too. What we know about folks with chronic pain is that they actually experience insomnia. They're more prone to experience insomnia. So your sleep issues are real if you have them. And again, sleep is a behavior. Really, everything that we're talking about today is a behavior. It's a skill for you to learn, and it's a skill for you to train. Sleep is no different, even though sometimes we think about it differently. So the purpose of sleep is for us to heal our minds and our bodies. When we don't get enough deep sleep, we wake up feeling not refreshed, right? So deep sleep is where our bodies heal itself. And typically folks that have chronic pain, if they're having sleep issues, they're missing that piece. Okay, so how do you fix that? Again, making sure that your sleep behaviors are adequate and helpful. Having a bedtime routine, going to bed at the same time or close to the same time every night and getting up at close to the same time every morning. That helps to get your body into that routine. And some people get so good at this that I can ask them, they'll tell me they're sleepy and I can ask them, so what time do you think it is? And they'll say, oh, probably about 7:30, because they are that accustomed to getting in bed at 8 or 8:30 that their body already knows and it's beginning to kind of turn down, okay? Maybe part of your bedtime routine is doing some breathing exercises. It might be doing some foam rolling to get rid of some of that muscle tension. It could be any number of things. Hopefully they're not things that get you all hyped up before you go to bed, but come up with a bedtime routine. Little kids have bedtime routines because otherwise they will not go to sleep. As adults, we think we're special, and so we don't have bedtime routines. I'm encouraging you to get good sleep when you can and to get a bedtime routine if you don't have one. If you are experiencing, if you try these things, and again, there's some resources on the back, I would encourage you to go to the National Sleep Foundation, and they have a whole list of things that we would want you to do if we were treating you, that we would have you do. If you try those things and you're noticing, man, my sleep is still jacked up, then please tell your primary care manager. It may be that you have some sort of organic sleep disorder going on, like sleep apnea or something along those lines that needs to be checked out. But try the behaviors first, really dial in your bedtime routine, your relaxation routine before bed. Make sure you're doing those things that we say are helpful. And if over a month or so you're still having trouble, then let your primary care manager know. All right, any questions, comments, concerns before I move on to nutrition?
We do have. Go ahead, Dave.
Okay.
Yeah, hey, Jackie, thanks. I was a little slow to the draw on the mute button earlier there. Some of that might be pain induced, Carol, when you were talking about your grandma and the cookies. At times I have so much pain, I can feel your grandmother breaking the legs on gingerbread man.
We're going to talk about that later.
We have two things. One was a comment that was made in the chat, and then there's a question I'll get to. The comment was, this individual shared that they have a hip injury, several decades old, that there are multiple things they're doing, acetaminophen to take the pain, a bit of the pain off, and some lidocaine patches and BioFreeze roll-on stuff. Is there something else that they can do? Any ideas? And while you feel that, I'll go to the next question.
Yeah, sure. So thank you so much for sharing. In terms of those more medical treatments, checking in with your provider and seeing if there are other alternatives to things that you're not already doing. One of the big things that I'm going to encourage you to do is to begin to incorporate the things that we're talking about here, right? Because again, the lidocaine patches and acetaminophen, those are helpful in kind of quieting some of that pain sensation and reducing some inflammation. But remember, there's still a whole other component up here that has to be addressed, and making sure your sleep is on point, making sure your nutrition is good, that you're moving. We say motion is the lotion. So making sure that you're doing those things in conjunction with those other treatments that you're doing. Often people will find that it helps to manage the pain even better than just using one of those methods, one or two of those methods. Hope that was helpful.
Question we have, boy, we've got a couple now. So the first question is, and this is one of those tip of the iceberg type things. My Fitbit says I get very little sleep and I get up 3 to 4 times a night. Is the Fitbit accurate?
So I will tell you that there is nothing as accurate as an actual, we call them actigraphs. It looks like a watch that you would get from the sleep clinic that you take home with you, and and you do an at-home sleep study, essentially. That's the next best option. And the very best option, of course, is actually having a sleep study. So Fitbit might give you a ballpark, but it's not going to be as accurate as something that is medically developed to track that. There was another question. Was there a follow-up to that?
No, I think that's good. I just needed to click something to have that go away. So you're good to go, ready for a new.
Okay. So again, you know, I think it's nice to have the activity trackers. It gives you, for many people, it's kind of accountability. For sleep specifically, that is a really difficult one. To have the algorithm that perfectly does that, you're going to pay a lot of money. And so the commercial folks will not do it as accurately, but I think it's still helpful in kind of ballparking, you know, if there's issues. Now, if you wake up in the morning and you feel refreshed, and you're not annoyed, you know, by how many times you're waking up, then I see keep the party moving. All right. So nutrition is a big one. And this is one that I personally can struggle with at times. Why? Because when I'm stressed out, I want to eat whatever I want to eat, or sometimes I don't even have time to eat. So it's one that can be very difficult to wrangle and be consistent with, but it's so very important to the treatment of chronic pain and any inflammatory disease process that you may have going on. So what I want you to remember about nutrition is that food is fuel and food is medicine, okay? You all, even if you have chronic pain, even if you're retired, even your brains, you're thinking a lot. Our brains use a tremendous amount of energy in our body. So if we're just being sedentary, we're still using some energy. And let's be honest, most of us have to get up and do some things. Okay. So these bodies, even though they don't always feel like they're premium, they are invaluable. We cannot get new ones. So we have to treat ourselves and our bodies better than we treat our cars. And some of us treat our cars pretty well. You spend lots of money on it. You are out there making sure that it's getting monthly oil changes, and you're making sure that it's nice and clean, and you're doing all of these things. Or maybe you do that with your house, but our bodies, it's an afterthought, right? And sometimes our pain gets so bad that we have to focus on it. But if we can really dial down our nutrition, right? If we really think about food as fuel for us to be able to do all of the things that we need to do during the day without putting extra strain on our bodies, because when we don't have enough fuel, we're pushing it, right? And if food as medicine, if we think about the fact that food has the ability actually to decrease inflammation in our bodies, just like an NSAID, right? Food also has the ability to inflame our body when we put junk in it that our body can't process. And I think there's some universal junks, right? But there are some things that are junk to us individually. So for example, some people, bread is the devil, right? And your body does not like it. For other people, it could be sugar. For some people, it's red meat. So I would encourage you to figure out what does your body like, what fuels your body, what makes you feel light and energetic, and find out those things that don't do your body any justice, right? So we have some, again, in our resource guide, there's some links for the anti-inflammatory diet. There's also some links for what we call the elimination diet, which is taking things out of your diet and then slowly reintroducing them and paying attention to how you feel. Okay. Generally speaking, caffeine, it has a purpose. We drink caffeine because it ramps us up. Perhaps being ramped up is not what we want to be doing, particularly when we're trying to manage our chronic pain. Nicotine. same thing. Okay, so it ping, 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 ping. That's maybe not what we want to do when we're trying to treat chronic pain. Most of us are severely dehydrated. If you are not drinking a gallon of water a day, I would encourage you to work up to that. Your body needs fluid, needs water to move smoothly, your joints to move smoothly. And so if you're like drinking one of these a day or two, you know, your body's not going to be happy with you. Okay. And then perhaps looking at adding on some supplements. We have a nutrition clinic and other places. There are other types of nutrition clinics, holistic, naturopath types of things. If you're interested and you're like, you know, I really know I should do better with my nutrition. I just have a really tough time with it. I would encourage you to make an appointment with a nutritionist so that you can better understand what you need to be putting in your body and how to make those behavioral changes in terms of your diet so that you can use food not as a supplement, but as a basis for treating your chronic pain. Food tracking also is helpful. Most of us overestimate how many calories we burned and underestimate how much food we put in our mouths and what type of food. So if you're curious, keep a food log for a week or two so that you can see what you're eating or not eating. And then you can go from there. And I would say keeping a log for most things, whether it's sleep, what time are you getting up, going to sleep, how much sleep are you getting, food, what am I eating, what am I not eating, movement, all of those things. I would encourage you to start with keeping a log so you can see where you are and then start implementing some of these skills and see where you go with it. All right. So the biggest, really not the biggest, I will say the last but not least, is movement, right? And again, chronic pain doesn't really encourage us to feel like moving, right? So many people with chronic pain, their activity levels are in the toilet. And because it hurts, right? Regardless of whether you move or not, chronic pain isn't about the movement creating the pain. Again, it's those pathways in your brain that are overly sensitive. All right. So yes, you can do all kinds of things and experience a spike in pain when you have chronic pain sometimes. So not moving is not the answer. Not moving is going to make chronic pain worse. It is not going to help you manage that in a way that is suitable to your life. Again, we have to retrain the brain, right? Movement is not bad. The only way to retrain the brain that movement is not bad and it does not inherently create pain is to do it so that you can give your brain new data so it can see, oh, okay, well, she didn't die. She went on a 5-minute walk and nothing bad happened. You might have experienced a little bit of an increase in pain, but you rested and you got back up and you re-engaged. Okay, so really movement is it's a balancing act, right? If flexibility. So you saw the yoga and aquatics therapy and all of those things. It is about strength. It's about endurance, right? So you might be only able to walk down the street a block, and that's good, right? I would say do that. And if it bumps you up just a little bit in pain, perfect, okay? You're gonna stop doing that, and then the next day, or maybe you'll rest, and if your pain comes back down to a level that you can handle it, you're going to walk another block, right? So this is a marathon. It is not a sprint. This is a lifestyle change. And it begins with these basic things. It begins with you starting to fill up each one of these tires, if you will, that we've talked about. For movement specifically, really for anything that we've talked about, pacing is the key. Some people are super gung-ho and they're like, yes, I'm going to do all of these things that we talked about. And they jump right in and something fails, right? You did too much too soon. So we want you to pace yourself. Remember, these are buildable skills. I go back to the gymnastics Olympic example because that's where we are right now. Simone Biles wasn't able to do a perfect 10 historic, floor routine or bar routine her first day of gymnastics. They were skills that she learned progressively. So we're going to teach you how to do this. Then once you master that, we're going to add this. Then we're going to add this. So this is the approach that I want you all to have in terms of starting to implement the things that we've talked about today, right? Movement is a good way for your body to tell you you did too much too fast. You didn't implement pacing in the way that was going to be most helpful. So again, like I said, I want you to journal and pay attention to the things that increase your pain. That doesn't mean not to do them. It just means I need to look at doing this differently. Did I do too much too fast? I tried to walk a mile and then I was dead the next day. Yeah. Okay. If you haven't done that in a while, then yes, you're going to be dead the next day. The problem with that is then you won't do it again for a couple of months and you're going to repeat that cycle, right? As opposed to starting off small. You know what? I haven't gone walking in a while. I'm going to try 5 minutes, right? Or I'm going to try X distance. At the end of that, I'm going to stop and I'm going to assess, what does my pain feel like, right? If there was no change, then tomorrow I'll do more, right? If it went up a little bit, that's okay. I can rest, and I noticed that it came back down to a place that was manageable, and I either decided to stop for the day or I did a little bit longer, all right? So pacing is really key to implementing any of these techniques that we talked about. So now that you have the techniques, what do you do with them? And we've already kind of talked about the pacing. You must have a plan. You must have anything less than a plan is a wish, right? And I don't know about you, but nobody's giving me my wishes. So we have to have a plan. What are the things that are important to you in your life? Maybe it's your family. Maybe it's golf. Maybe it's work. Right? What are the things that are important to you and how well are you able to do those things, right? How much is chronic pain disrupting those things? And I would say, let those be your points of focus to indicate where you're going to go first and improvement in functioning. If you're able to go out and hang out with the family now, excellent. That is a win. You may still have pain, but you're more functional in that area that's really important to you, and that improves your quality of life, and that helps you to decrease some of that stress and anxiety you might be feeling about having chronic pain. So set goals. We want them to be smart. All right. So specific goals, I'm going to stop eating fast food. I want it to be more specific than that. I'm going to eat, fill in the blank. Right? I'm going to eat the appropriate serving of vegetables per day. Okay. That is a specific goal, and you can measure that goal. So your goals should be measurable as well. So I take the measuring cup and I can measure that that I'm giving myself how many ever ounces of vegetables you decided you wanted to have today. Action oriented. So I said, you're not going to do something is not the best goal because it's not action oriented. It's just, I'm not going to do that, right? What are you going to do? They must be realistic. So saying, yeah, I'm feeling motivated. I'm going to run the Honolulu Marathon. If you haven't been running or even walking in the last few months, deciding that you're going to run the Honolulu Marathon may be a bit ambitious, right? So have realistic goals, and they must be time bound, right? So I will challenge you all to set some goals today for tomorrow, just 24 hours. Tomorrow, I want to do one goal. Then set a goal for a week. For the next week, I would like to do fill in the blank. Okay, for the next month, I would like to do fill in the blank. So make sure there's a beginning and an ending where you're going to check in on your goals. And the longer your goals get, the more frequently you're going to have to check in. So if you say in 30 days, I want to have consistently eaten fill in the blank, don't wait until 30 days to assess how well you did that. Weekly, you need to look at your log and say, oh, well, I totally jacked up Tuesday, Wednesday, and Thursday. What happened? How did you get off track? And how are you going to get back on track the next week? All right. So have a plan, set some goals. Lastly, we used to see veterans and family members in the pain clinic here at TAMC. We are no longer doing that. We currently, so maybe that service will we'll revisit that in the future. But there are several providers on Oahu that we are referring folks to. Again, you all have access to this list of folks. And then this is the resource list that I was talking to you about. So chronic pain education, books about chronic pain that we all find very helpful, apps. A lot of our service members are super techie. I personally prefer the old school method of keeping logs and doing all those things, but whatever is going to help you to engage in the activity, do it. Some sleep resources, nutrition resources, smoking cessation, and then some resources for complementary and alternative medicine. That is all I have for you all. I know that went fast. I apologize, but I am open for more questions if you all have them.
Hey, a quick one you've got here. You were talking about movement, and when you were talking that's when this question came up, and it's kind of putting money to movement. Does TRICARE pay for yoga?
I do not believe that TRICARE pays for yoga. However, are you guys still there?
We're still here.
Okay. However, TRICARE is more and more paying for things that they haven't traditionally paid for. In terms of kind of free programs, I suspect that as COVID starts to lift, that people will begin to re-engage and begin to offer yoga classes like at the gyms, on post. And so that's a free way to get into yoga. Once again, COVID restrictions lift and everybody kind of perhaps begins to resume their day-to-day lives. The other thing that may be helpful is there are lots of yoga videos on YouTube that are free. And if you really want to get serious, there's DVDs and things that you can purchase. But to my knowledge, TRICARE is not paying for yoga.
I think that's it for the questions. I just wanted to comment on what a wonderful talk that was. I know that you've got classes that you run, which are hours, and to consolidate or condense this down into being very digestible and user-friendly, not only for the active duty lane, but the whole scope that we're looking at tonight of retirees and veterans. Thank you so much. And you know, little mea culpa here, I used to have a pretty good sleep regimen. I prided myself on that as a clinician. But you know, my sleep routine now is my wife or daughter nudging me on the floor of the couch saying, "Dad, go to bed." Because my position shifted to the Pentagon. So I wake up at like 2, 3, 4 in the morning, depending upon what call I have. So I've tested that, and that's like 1 or 2 days out of the week. So that circadian rhythm, that routine, you know, you really got to be mindful of that. But I don't want to fail as a dad or as a husband. So it's one of those, let me just hang out and try watching.
Yeah. No, I appreciate that. I think that's the struggle for all of us. And I'm glad you brought that up, because, you know, it is not, I think we have this illusion that we're going to have all things in our life in balance at all times. And that's just not how that works, right? And so our priorities will shift during our life. Now might be your time to prioritize your chronic pain treatment, right? And so it's like, hey, I love, staying up late and hanging out with folks, but in this season, I really feel like I've got to focus on getting my pain to a level that is manageable. And then, in 3 months from now, 6 months from now, I can reevaluate and see, what gets my priority. But so it's a myth, right? That we're going to have this figured out at all times and everything is going to be balanced, a work-life balance, right? I feel like it's the work-life balance over our lifetime, right? Because certainly sometimes we got to work and sometimes we can play harder. And again, the other thing I would encourage folks to do is you start to find stuff that works for you. Write it down, right? What are the things that I found that help me maintain my pain level at a level that is functional for me? So it might be a 2, might be a 3, might be a 4. If you're out living life in the way that you can, awesome. What are those things that are helpful, and stay with that routine, right? Now, you might find something and a year into it, your body's like, okay, I'm bored. And it's not doing a good job managing your pain anymore. Revisit it and come up with some new things. But this is about skills building. We want you to have a robust toolkit, one that's good for managing pain and one that's good for acute pain flare-up. So the person mentioned the lidocaine patches. For some people, they don't use those all the time, but when that pain really gets going, they'll slap a patch on there, and that's helpful for reducing pain. So yeah, thanks for bringing that up.
Again, thank you so much for all that you put together. I see from what's behind you there, you're still in your office. That is a triple.
I am still in my office.
and I did tell Colonel Bonfiglio, I think it was on Monday, he and I had an early call. So I'm going to reach back to him and say that you're working extra so that they give you some time. Hey, there's an evaluation process here. Jackie, did you want to take that?
I just put it up on your screen. So if you don't mind just taking a moment to give us your thoughts on the presentation. I have to say, Dr. Cox-Coleman, it's good that I don't have the capacity to submit questions because I had about 20 of them. And I think you and I could probably have coffee for a few hours and it would not answer all my questions. I love your presentation. And
well, thank you so much for your questions. And if other people have questions, you all have my email address. I would be more than happy to answer any other questions that folks might have or might have wanted to ask and just weren't comfortable. So you have my email address and I'll be more than happy to answer those if they come up.
Wonderful. Thank you so much. And thank you, Dr. Brown. And thank you everybody for attending. I do want to just remind folks that we do have 3 more events coming up, and they are the estate planning session this Friday, which has, believe it or not, 100 people signed up for it. Our behavioral health panel discussion, which should be very interesting. Dr. Brown has obtained 4 different panelists. And then, of course, former POW Jessica Lynch talking about her experience overcoming that. So I hope you'll join us again. You can sign up at hawaiiveteransfoundation.org or at aarp.org/near-you. That's aarp.org/near-you. Thanks, everybody, and we look forward to seeing you next time.